Welcome to the Senior Focus. My name is Nick Kaltsis and I'm your host. I'm here with Renee Smith and Mark DiStefano, both from Bayada Home Health Care. Say your name right?
Yes, you did.
DiStefano.
You're one of the few. Thank you.
One of the few. So I thought that I would start with Renee and say, Renee, you're the director of the Worcester office. Is that right?
I am.
And what kind of things do you do as the director of the Worcester office?
So in Worcester, our office actually has two programs out of the same location. We have home health, which is the Medicare certified or medical model home care, of which I'm the director, and then we also have assistive care, personal care services, which Mark is the director for. So with the Medicare certified program, we provide skilled nursing, therapies, social workers, and home health aides, usually reimbursed by insurances, and the type of care that we provide is intermittent and episodic, so it's usually following a hospitalization, a skilled nursing facility stay, or even just an exacerbation of a chronic illness.
So when you say intermittent or episodic, tell me again. What do you mean by that?
Means we're not there 24 hours a day.
Okay.
Our clinicians come and go for visits, usually about an hour in duration. We put together a plan of care under the orders of a physician, and usually a home health episode is about 60 days in duration, although there are some instances where people require less than 60 days and some instances where they require more.
And that's the Medicare program?
Yes, we're certified. We're licensed under Medicare, but we do accept many insurances besides Medicare, yeah.
Medicare would never tell you provide 24-hour care, would they?
No.
But you would provide 24-hour care in the event a person needed it, right?
Absolutely, and that would be under Mark's program.
Okay, and let's talk to Mark then. As far as what you're the director of assistive care, is that correct?
That's correct, yes.
What is assistive care?
Assistive care is essentially personal care, and we have on our team home health aides, homemakers, and companions. You alluded to 24-hour, 7-day-a-week coverage. We have a case like that right now, where we've broken up the 24 hours with home health aides in 3 shifts, 7 to 3, 3 to 11, 11 to 7 a.m.
Okay.
Home health aides would do direct personal care, such as bathing, assistance with dressing. Homemakers, it would be more meal preparation, cleaning, laundry. And companion is just that. Just going and sharing some time with the client.
Is there a difference between, I think you had indicated like home health care and what would I call it, skilled nursing care? Is there a differentiation between the two that you guys see? Or are they the same thing?
Well, I think home health, the program that I work with, we focus on the home environment, the family, a lot of what Mark's program focuses on, but we're also focused on a specific disease process or helping someone manage their health or improve their health or get through an exacerbation of an illness. Mark's program is more of a maintenance program to keep people safe at home long term.
You know, when I think of keep them safe at home long term, I think more of like a custodial type thing where, you know, someone's not safe to be at home all alone. So whatever services they require to keep them in their home, be able to keep them safely in their home, as opposed to you know, whether they need IV treatment or some other skilled nursing care. Am I off base there a little bit, or is that pretty much?
No, and I think Mark would speak to this too, that our programs are very much complement each other and we work very closely together. So although his program is not a medical model, every client that comes on to the assistive care program is managed by a clinical manager. And so they still have that nurse going in on regular intervals, assessing their health. And if something does arise or there's some type of a health crisis or a need for skilled services, then our two programs communicate, and so we can coexist in the same home.
And with respect to, we'll say, the credentials of the employees that work in, both divisions, are there differences in the credentials? Are they both, manned by people that have, nursing degrees or, physical therapists, that type of thing?
You want to talk about who you employ and how you screen them?
Sure.
Yeah.
Our home health aides are all certified typically through the Red Cross. And the whole screening process starts with when they first apply and fill out the application. We're going to bring them in for an interview. After the interview, if it's successful, we're going to reach out and call their references. Then we do an extensive background check. And then after we have not only done the background check and verified their certifications, we bring them in for a 4-hour orientation with our clinical manager and also our client service manager. It gives us a chance to really determine if these people are ready to be sent into the home. And once they go through that and once they pass their tests that they are given that first day, we can employ them within 24 to 48 hours.
All right, so for employment, there's a screening process. It isn't just anybody. They have to have certain credentials. You verify, make sure that they have those credentials, follow up on the references, and then there is a orientation program, you said?
Yes, 4-hour.
What's that like?
4-hour orientation program where they come to the branch. They basically are introduced to the Bayada way, which our core values really are predicated on 3 things: compassion, reliability, and excellence. And through the conversation during the orientation, we can determine if these people are going to be part of the Bayada team. They are given a couple of tests. They certainly, during the orientation, are introduced to all the players, all the way up to Mark Bayada, the owner of the company, during that time. But we huddle, the clinical manager, the client services manager, and myself, post-orientation to determine if however many we had attend are ready to be active members of our team.
You mentioned the Bayada way. And Renee, you've been with me before on the program. I really can't talk enough about the Bayada way because there are some instances, examples of what the Bayada way means that I thought were fairly profound. There was an example that was provided that I talk about I think it was a year ago, a big snowstorm, people couldn't get in and out, and basically the care worker that was providing care, I think it was 24-hour care if I'm not mistaken, couldn't leave, and the other worker couldn't get there because the roads weren't plowed and the driveway wasn't plowed. So one of your employees actually walked to her house to provide the care, which I thought was really a testament to the person's dedication.
That particular aide works predominantly on our assistive care side of the business. She is by far and away one of our best. And the contingency plan during that snowstorm was for myself to pick her up and get her to the client's house. I couldn't get out of my driveway.
Right.
So as we conversed over the phone, she decided I'll just walk the 6 blocks.
Right.
Took her over an hour.
Yeah.
But she was able to relieve the aide that had stayed overnight. That's an example of the Bayada way.
Right.
I think another example too is Mark's team was recently recognized. We have an annual awards weekend once a year in the travels around the country, but all of the Bayada offices, and there's over 200, we get together and we recognize our heroes on the home front, which is our field staff. And Mark Bayada gets lots of letters from families and patients, thanking us for the type of care that different offices provide and telling their stories. And he had received a letter from the family of, I believe, a hospice patient.
That's correct.
You want to tell the story? I'm telling your story.
That's okay. That's how close we work together. It was a late Friday afternoon. Called this particular daughter of the client called several home care agencies to say, my mom wants to come home to pass. It would only be a couple of days. Would you have aides available today? I guess in her previous 3 or 4 calls, the other home care companies were not able to staff that immediately. We took the call. We had the nurse out that afternoon to do the assessment, and we provided home health aide coverage through the weekend starting that Friday night.
You know, what I want to do is concentrate a little on the differences between medical and non-medical services that are available.
Okay.
So maybe you can talk about the medical services as opposed to the non-medical service.
Sure. So medical services would be nursing. So you're skilled professionals. So nursing, physical
So like if someone had a
therapy.
knee replacement or a hip replacement and they're lying prone in bed and they have that continuous motion machine and they need a nurse to come check on them.
Yeah, a nurse would, a nurse would be involved in post-joint care for sure, but also therapy would be really important.
Right, okay.
When you have any type of a surgery, including a joint replacement, there's usually an incision that needs to be monitored, and usually you want to watch for signs and symptoms of infection. Sometimes folks are at risk for blood clots, depending on if they came right home from the hospital, if they rehabbed in a facility. Usually there's multiple medication changes. People may be deconditioned from being in a hospital bed, or if they've had some type of a joint surgery, they'll need physical therapy to regain their range of motion, maybe occupational therapy to focus on activities of daily living and upper body strength, and then often a home health aide to help out with showering
I always
and
found that
bathing.
confusing. They call it occupational therapy.
I know, I
so
don't know.
I can remember, when I first, broke into the field, I would always think, well, occupational therapy, that must be, in regards to someone's occupation.
Getting back to work or something, right?
helping them, vocationally.
Yeah.
That's not what it means at all,
Yeah.
right?
Right, no.
And specifically when someone out there hears occupational therapy, what does it mean?
So a lot of the things that our occupational therapists focus on are upper body strength, range of motion, but also things to do with caring for doing their own personal care. Things around household chores, but they do a lot of work with cognitive issues too. Folks who have had a stroke are having difficulty with memory and
Like having the strength to get out of a chair, carrying something.
using a stove. Sometimes you
yeah.
have to make some adjustments and use some adaptive equipment following a stroke or a surgery. So that's where an OT could come in and help.
Right. And as opposed to medical services, the non-medical services that would be provided or could be provided?
Well, in that instance, if the individual needed more than intermittent visits, like 1-hour visits, if they needed more supervision at home to be safe following a surgery, then that's where Mark's program would come in. So Mark doesn't just do long-term care. They can also do shifts and longer shifts, but for shorter periods of time. It may just be following a surgery or a hospitalization.
I have a client and her sister's in a nursing home and she, desperately wants her sister to come home. They've basically lived together their entire lives. They're in their late 70s now. Neither of them are married. Neither of them have children. They've literally spent their entire lives together, and there are certain things that they need. When we come back, because we're going to have to head to a break right now, maybe I can ask Mark about, some of the things that are possible for these people.
Sure.